to the kind of myths and truths, because we're coming to the end of our kind of interview anyway. So you just tell me true or false, okay? I'm going to whirl some kind of phrases at you, all right? So is it true that if we leave bigger gaps between children, it's harder to conceive? True or false?
False.
I bet it's not as black and white, is it?
It's not as black and white, because if you leave too much gap, then your age will have the effect rather than the gap between the children.
Oh yeah. Okay, good. I like that. It was very prompt. Very promptly put. We have already addressed this one. This one was about if weight affects fertility, and you've already addressed that before, so that's fine. Okay, this one's a bit of a weird one, okay, and a bit of a rude one. So, is it true to lift our legs in the air after sex to let gravity take place to conceive?
False.
False. Okay, so women, you do not need to be putting your legs in the air. Okay. Okay, the next one, again a bit of a rude one. Is it true that the missionary position of sex is the best position to get pregnant?
No.
False.
Not.
Okay. Oh my gosh, I wonder where all these come from, honestly. Now this one, okay, is it true that once women have miscarriages, that it can likely happen again?
So miscarriage, sorry, I'm not answering true and false here. Miscarriages are very common. 1 in 5 pregnancy end in miscarriages. So, but the chances of having a normal pregnancy, even after 2 miscarriages, about 80–85%. So yes, you are probably at a higher risk of miscarriage after 2 miscarriages. After 1, we don't normally tend to investigate. What we advise you is, again, the lifestyle factors, which we advise everybody. And if you're older, if you've got high weight, then you are at a high risk of miscarriages, whether you have had previous miscarriage or not.
Okay, all right. Okay, that's very useful actually for people out there, because we do get as well people who call the helpline and talk about miscarriages, and the kind of counselling side of things too for it. So that's great to know as well. Now we had another kind of, well, it was more of a question about people asking how they can improve their chance of having twins. I mean, can you do anything to improve your chance of having twins?
Can I just say that twins are not really buy one, get one free. Twin pregnancies are associated with very high risk. And as a fertility specialist, the whole world has worked very hard to reduce the number of twins after fertility treatment. And we are very proud to say in UK, it is less than 10% right now. So twin rate, we have stopped transferring 2 embryos. And if you remember when I was speaking about IVF, I said we select the best embryo, not embryos. So why do you want twins? As my question.
Yeah.
Twins is not the outcome I would be looking for.
Right.
What we are looking for is a healthy baby in your hand, and a healthy mom and a healthy family. And it's the singletons rather than twins which gives you that.
Okay, yeah, no.
You have as many babies as you want, one by one.
One by one. Okay. Well, thank you so much for that. Honestly, that was really, I mean, it's really interesting. I wish I could have more time to talk to you about it, really. But, you know, I think we've asked enough questions, really. But it was a pleasure talking to you, Abha. If anyone wants to discuss anything about the cultural pressures or the stress that they're going through with trying to conceive, or with issues with fertility, you can call the Muslim Women's Network helpline. We're on 0800 999 5786. Always contact your GP if you have any concerns. You can also visit the NHS website for more information about IVF or fertility, if that's what you want to be reading about. So thanks so much for watching. We hope that was helpful. And until next time, bye.
Thank you very much. Bye.